Substance use and addiction impact the autonomic nervous system. A lot of people think it just impacts neurotransmitters. Well, no, it impacts the whole kit and caboodle. Your gut microbiome, your nervous system, your vagus, everything. Substance use floods the body with a toxin. This is stressful. When your body is flooded with a toxin, it goes, oh crap, this is not suitable for survival. Things are out of whack. This is a problem. These toxins alter neurotransmitters in unnatural ways. All of a sudden, your dopaminergic receptors are just being inundated with dopamine, and your receptors are being inundated, and they're just like, oh my gosh, I can't take it. This is too much. Think about the poor people that are working in retail on Black Friday. Kind of like that. It's just like, oh my gosh, I wanted customers, but not this many. Thank you. When the substance leaves the body, the autonomic nervous system cannot compensate as quickly. Just because the substance isn't there, the alcohol, the opioids, the testosterone, whatever it is, it leaves, and then the receptors are like, what happened? Wait a minute. I was just starting to get used to being overwhelmed, and now all of a sudden, all I hear is crickets. And it's a very stark contrast, which is when people start craving again. And this is obviously more pronounced in people who have addictions and they've become tolerant, because it means that the receptors no longer are triggered by normal levels of dopamine, norepinephrine, endorphins. They get those normal physiological levels of those neurochemicals. They're just like, whatever. I'm not worried about it. It takes a supratherapeutic dose, which is re-administering this substance. Now, can the body heal and reawaken, if you will? It's oversimplified, but reawaken those receptors? Certainly. But it takes the body a while, months sometimes, to recognize, hey, I'm not going to be flooded anymore. So I can be a little bit more sensitive to what's going on. Engaging in addictive activities also floods the body with supranormal levels of dopamine, endorphins, and possibly certain hormones. They found with pornography and sex addiction, for example, that the combination, especially for men, the combination of the dopamine, the endorphins, and testosterone, they actually enhance each other and make that rush, make that intoxication more potent than any of those neurochemicals could do individually. In any event, you're still flooding the body with supranormal levels. You're not ingesting it in some way, but you're ramping it up in unnatural ways. These high levels of neurotransmitters alter other hormones and neurotransmitters, which create stress on the body. Anytime any system gets out of balance, it's stressful, and that will trigger the stress response. As the stress response is triggered, we start to see changes in motivation, changes in mood. We start to see epigenetic changes because stress triggers a whole different set of genes to be turned on in your DNA than no stress. Engaging in the behavior enough, people can become dependent on it to have normal levels of hormones and neurotransmitters, or else they have cravings. People who engage in behavioral addictions, gambling, porn, sex, whatever, very often do have very legitimate physiological cravings in addition to psychological cravings, because their hormones, their neurotransmitters, their nervous system, totally out of balance. Other stressors common to all addictions. So not only the use of the substance or behavior throwing the neurotransmitters out of whack, but other things that we see or in my experience, I've seen in most people that I have worked with addictions, circadian rhythm disruption. Even the very few people who are keeping a steady sleep schedule, they're not sleeping as well because their neurotransmitters aren't there, because their cortisol's too high, not enough melatonin, they're not getting good quality sleep. Gut microbiome disruption. Remember, the foods we eat are taken in and broken down by microbes and repackaged into hormones and neurotransmitters and what we need to survive. If those microbes are disrupted, killed off, become imbalanced, then we're going to have a hard time making those hormones and neurotransmitters we need to feel good. Again, just like the nervous system can retune itself, the gut microbiome can repopulate itself when people are eating a healthy diet. And this is one of the areas that we really need to focus on, in my opinion, more effectively in outpatient treatment programs, educating people about the importance of nutrition, as well as in some residential programs. One of the residential programs that I worked at, they had really good food. But in terms of being anti-inflammatory, not so much. It was very Southern, very high fat, not a lot of color, not a lot of fiber. So it wasn't anti-inflammatory. And the body, when it's recovering from addiction, has a lot of excess oxidative stress that needs to be cleared out. Remember, oxidative stress are the byproducts of living. But when we're stressed, we produce more byproducts, we produce more trash. And generally, if you're not eating an anti-inflammatory diet and doing all the things that you need to do to be healthy, which most people in addiction are not, then that oxidative trash builds up, and we need to help people get it out of their system. So an anti-inflammatory diet is helpful. All that means is having a diet that's rich in fiber, that's colorful, and that minimizes overly processed foods. Ideally, it has a good dose of omega-3s, but the first three, definitely. And that can really help the gut microbiome heal, because guess what? Those foods and fiber feed the microbes. If you give them healthy microbes the food they need, then they will repopulate.